Welcome back. This is your Feel Good Breakfast Show. It's a Tuesday morning. We're live, large and in charge. Thanks for joining us. Now, did you know that 75% of all cases of blindness are avoidable either by treatment or through prevention, in fact, completely. And so we're commemorating Eye Care Awareness Month with the objective to not only raise awareness about the importance of eye health, but also to let you know about the prevention and treatments that are available out there. And of course, to unpack that for us, our medical specialist, Dr. Darren Green. We're also going to be keeping our lines open on 0214309881. So give us a call if you have any questions that you'd like to have heard by the doctor. Thank you very much once again for joining us.
And we've got questions for you.
Good,
My first one
Yes.
is, what's the difference between an ophthalmologist, an optometrist, and an optician? Because it can get quite blurry if you don't know.
I see what you did there. Long word, short word. So basically an ophthalmologist is an eye specialist that studies medicine first and then goes to specialize for another 4 to 5 years after that. And the primary difference between an ophthalmologist and an optometrist is that the optometrist can prescribe drugs to treat medical conditions of the eye, but the ophthalmologist can perform surgery. An optician, on the other hand, is a technician that works with very technical things in terms of designing and making and fitting lenses, specifically helping people with refractory problems in terms of eyewear to adjust, you know, to optimize their vision.
So obviously before seeing any of these specialists, you'd first need to know that there is a problem. So let's talk about how early and when one should have one's eyes examined, except for the traffic department where you have to look through and...
So often if there's an obvious warning sign, it would be something like people doing facial grimacing. So your facial expressions to strain, to look, or headaches is often an indicator. When children are very, very tiny and small, they often could have things like strabismus or squints, for example, where the alignment of the eyes and the muscles aren't perfectly balanced, you know, in keeping the eye central, and then moving left and right, there might be a deficit. So you might notice malalignment issues physically, but you can also look at whether someone turns their head in funny positions to actually direct or correct the mistakes. But a lot of people don't know they've got eye problems because they don't bother checking. If they have things like hypertension or diabetes, the damage, because of the small blood vessels that lead to the eye, are affected by hypertension and diabetes, lead to progressive eye changes. So you don't know often that you've got those changes until you obviously see the ophthalmologist. In that case, you'd have to see them annually at least to see how it's changing and whether the sugar control and blood pressure control has been good.
So you mentioned children, and it's quite interesting for me. In children, if you're not taking them to get examined, what are some of the things to look out for? Did you say the squint, for example, would be
you
one?
could look, malalignment issues, so a lazy eye. You can remember, you can look at the eye, you can look at the eyelids, you can look at whether the eyes are beautifully central when they gaze in central gaze, for example, as well. You could also look at the facial expressions of grimacing and trying to focus. And also whether they bump into things. It sounds so obvious, but you'll be surprised how many people have a visual field defect or an eye defect and bump their shoulders into the doorposts.
Wow.
One going through a door, or taking a corner, or whatever, little things like that. And then obviously things like sport, where you have to recognize and track a ball or something, where they just can't do that. And that's often an early warning sign.
And eyesight does deteriorate over time, right? Within all humans.
Within normal physiology, yes.
Exactly.
There are changes that happen to the eye muscles. There are also changes that happen to the shape of the globe of the eye. A normal eye is like a baseball, you know, beautifully, perfectly round. But depending on the shape and how that can be elongated, like a football or American football, or a rugby ball, if it's that shape, then you start having astigmatism and other problems.
Oh, wow. Our lines are open, 0214309881. What do you want to ask Dr. Darren Green and want to know about eye care? He's staying with us. We're going to be continuing this chat, so give us a call.
All right, well, lots of sleep is one of the things that you need to ensure that your eyes are very healthy, especially if you want to get these white parts of your eyes super white. I don't know if Hollywood stars sleep all that much.
How much then do you need to be sleeping?
Yeah, we'll get to that now. But our lines are open, 0214309881. I believe Naz from Edubani. Morning, Naz.
Morning, guys. Morning, gentlemen. I have a question for Dr. Green. I have very bad eyesight, My right eye is -9 and my left eye is -7.5. I want to know, is it advisable to do laser? And I'm 30, so would it be advisable at my age to do laser to correct my eyesight?
Thank you, Naz. Thank you
Great
for that
question.
question.
So she'd obviously consult an ophthalmologist here. The laser is a form of surgery that we use to correct the refractory deficit. She describes those numbers, 9 and 7.5. People that go to the local pharmacy and buy a pair of reading glasses, buy a pair of glasses that can correct that deficit, but they're normally the same left and right.
Yes.
True, when you look at the fine differentiator of maximizing your vision and focus for things like reading, for example, you need specifics in terms of that numeric value, and the lenses can differ left and right, like she described, 7.5 and 9. And it's quite a technical field, you know, but the long and the short is laser surgery certainly has proven to help thousands of people. Very useful form of treating the refractory errors. But we look at the comorbid picture. We look at her age. She's 30 years old.
Yeah.
One would also want to look at the other issues in the eye in terms of what are the eye pressures like, what are her genetic factors, what are her comorbid lifestyle diseases, does she have diabetes or hypertension, and that kind of thing. So there's a whole list of things that we use in terms of deciding who's a good candidate for surgery. But your ophthalmologist will definitely guide you in that process.
Yeah.
But the results of laser surgery are very good.
Okay. Well, we have another call on the line right now. Marilyn from Cape Town. Good morning.
Good morning.
Morning.
Great to have you.
I'm fine, yourself.
Very, very well.
Very
Thank
good,
you. What is
thank
your
you.
question, Marilyn?
Doctor, I had a laser treatment. It was on Thursday, last week Thursday.
Wow. Yeah.
But I had cataract removed. That was 2006. But now the problem is, when I came out of that, from the doctor, I had big spots in front of me. It's now floating around. And now it decreases to small little spots. I mean, so I just want to know, is it something that I had to worry about or what?
Thank you very much for that, Marilyn.
Good. So she describes having cataracts as well, operated in 2006, and then now obviously laser surgery to correct the lens and refraction and so forth. She describes what's called floaters, and so many people ask me about floaters. What are floaters? No, they're not those floaters. So floaters refer specifically to the appearance of almost shadow hair-like structures that are floating around. If you look up at a clear surface like the sky sometimes, you lay on your back at the beach, look at and you'll see these little black hairs almost moving around in shadow-like structures. It's actually solid bits in the vitreous gel at the back of the eye. So what happens is when the light comes through the eye, those floating bits of solidified gel particles or blood particles or, you know, or white cell deposits even, cast a shadow on the back of the retina of the eye, which you then see as those. They're not always harmful or dangerous. They can be associated with retinal detachment, which is an emergency. If obviously there was trauma to the eye, obviously acute light flashes with all that. But generally the cause is some deposits in the vitreous humor. And surgically, if it's really bad and affects your functioning day to day and your driving and your activity, they can actually go into that chamber at the back, remove all that fluid, the vitreous fluid, and put in another substance. Obviously.
So I just got like a chill throughout my whole thing. Like I'm probably the worst candidate for any kind of eye surgery or eye work. But we'll be back again with Dr. Darren
We
Green
will
shortly.
be, indeed.
Oh my goodness.
100%.
Give us a call, 0214309881.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show, Expresso on SABC3. We're still hanging out with Dr. Darren Green talking about eye care awareness because we're commemorating Eye Care Awareness Month, all of this month. And it's been quite interesting learning about our eyes and the different functions, the different things that happen, and when to get worried and when not to get worried. But Dr. Darren Green, I wanted to find out earlier, as someone who wears glasses, why is it that people then start to find it difficult seeing without their glasses?
Yes, so as I mentioned earlier on, the shape of the globe of the eye can change, but also the front surface in terms of what astigmatism is, means either the lens at the front part of the eye or the shape of the eye change the contour, you know, that front perfectly round
So
nature.
over here,
That's correct. And what happens then, you can imagine when light comes into the eye through the pupil, which can dilate and constrict, obviously it's then bent by the shape of that lens. And that lens over there has a contour on that side and that side, but not everyone's lens looks the same. Might be more curved on one side and less curved on the other side. And people then need, obviously, with aging sometimes, the shape of the lens can change or degenerate over time. And that will need to be corrected then by different options in terms of refractory errors of the eye.
When you mentioned that word, that takes me back to, I think, grade 10 physics.
Refraction.
Refractions and
Prism.
prisms.
Yeah.
Exactly.
The light.
So let's try and explain what it means to be nearsighted versus being farsighted.
Yeah, so nearsighted you can see nearby.
Okay.
Farsighted you can see easily when things are distant. And the reason for that is when you're nearsighted, what happens is because of the way the light is refracted and focused on the retina, because you're able to see, you need the light to come in through the lens, the pupil and the lens, and be sent all the way back to the retina, which is at the back of the eye over here, specialized cells, to collect the signal and send it to the brain. But what happens is the signal falls short of the retina when you are nearsighted. And then it needs to be corrected so that...
so then you can only see it when it's really here because it's really strong.
That's right. So
Versus if it's very far, then you can't.
So getting that exact point where it actually focuses the light onto the retina, obviously, is what the lenses then do. And if you can be near and far-sighted at the same time, in which case they would use bifocal lenses to help you correct the refractory errors.
What is it called when you're both near and far-sighted at the same time?
I don't know. I can't remember right now. But I used to know.
Bi-sighted.
By-side.
Quite interesting, though, that you can have both at the same time. But then, obviously, the good part is that you need special lenses, obviously. And the bifocals, you can see, have a different shape, the top and the bottom.
I wanted to ask something now, because one of our callers early on referred to their eyesight being, let's say, a -9 on the one eye and a -7.5. And is hindsight truly 20/20? And is 20/20 perfect vision?
The perfect vision.
Yeah, so 20/20 actually is an old term that we use. You know the Snellen chart, the one with the E's? That
Yes.
Yeah.
That
It's called a
that
Snellen
way.
chart.
Snellen chart is what we use.
Yeah.
And it means 20 feet away is what a normal person can see at 20 feet away from that chart.
Okay.
So that's why the distance from the chart's important when you measure it out and put a piece of tape
You
on the
can't just
floor.
make somebody stand randomly and be like,
Randomly,
"Okay,
it
read me
needs
the
to be
bottom
accurate,
letters."
and then they can see which row they can go to, and that's then coded. So 20/20 vision implies you can see at 20 feet the row that a person with normal vision at 20 feet can see.
And is that why then, like, you would cover one side of the eye to read as many as you can?
Of one eye.
And then, so it's 20
two
feet
separate.
on the one eye, 20 feet on the other.
20/20.
But that's interesting. But doctor, how do you prevent your eyes from getting damaged?
So the first thing is, I think a lot of people, if they have a symptom, like pain, like blurry vision, change vision, don't ignore it. Obviously, if there's an obvious thing like sand getting in your eyes, sure, wash it out properly with water, etc. But, you know, more importantly, we need to obviously look at protecting the eyes from the sun. Strain on the eyes, bright lights for long periods of time, glare off the screen. We have things now and mechanisms of filtering that bright LED off your screens if you work with computers for long periods of time.
Yeah.
Your ergonomics, your distance from the screen, your breaks that you need to give your eyes. I mean, how many of you have seen the eyes jumping when they twitch in someone?
I wanted to find out about that
Yeah.
because I grew up knowing that if your eye's twitching, two things are either going to happen. One, you're going to see someone you haven't seen in a long time, or two, you're going to get money that day. So
When your eye twitches.
when your eye
for
twitches,
money.
it depends if it's the bottom part or the top part. If it's the bottom part, you're getting money.
mine
If it's the
twitching.
top part, you're going to see someone.
So often it's
I want my bottom part twitching all the time, obviously.
The twitching of the eye, the term is myokymia, for those that want to Google it, ocular myokymia. And it often is a benign condition associated just with strain on the eye muscles, lack of sleep, and obviously straining long periods of using the eyes. So protect your eyes by wearing good eyewear with UV protection and polarized lenses to help in terms of reflecting the eye away from you.
Dr. Green, thank you very, very much. I think at the end of the day, when we said in the beginning that 75% of all cases of blindness or some kind of eye defect is preventable if you are screened and if you keep your eyes healthy. So
100%.
this Eye Care Awareness Month, make sure that you do take care of yours.